Well, thank you very much. I'm Dr. Kevin Kavanaugh, Board Chairman of HealthWatch USA, and would like to welcome you to our 16th Annual Conference on Healthcare Safety. This year's conference focuses on the important topic of frontline worker safety in the age of COVID-19. COVID-19 imposes an extreme risk to our frontline workers. The Brookings Institute estimates that there are between 2 to 4 million workers, or approximately 2% of the United States workforce, that is not working because of long COVID. An online survey of 3,762 suspected and confirmed long COVID-19 patients was conducted by The Lancet. 45.2% reported requiring a reduced work schedule compared to pre-illness, and 22.3% were not working at the time of the survey due to their health conditions. There was no difference between the suspected and confirmed group. Long COVID was named as one of the main drivers which shrank the United Kingdom's workforce by 440,000 people up to February 2022, compared to the fourth quarter of 2019. The CDC is also tracking healthcare worker safety in the age of COVID-19. However, the data is incomplete. Deaths could be up to 13 times higher than that which has been reported because of incomplete and also not reporting of data. There, unfortunately, is no accurate tracking. But as of September 8th, healthcare personnel deaths totaled 2,312, and healthcare personnel cases 968,338. Now, this is a map of the United States, and the United States is currently in a sustained wave of COVID-19 cases due to the BA.5 variant. The arrow points to where in eastern Kentucky you can see is actually the hot spot for COVID in the United States. Unfortunately, the arrow is also pointing to where I live. And because of this and the difficulties we're having in controlling COVID-19 and the risk to our frontline workers, we've organized this conference with the following outcomes. First, to identify infection control strategies that prevent and mitigate the spread of COVID-19 disease in healthcare facilities among frontline workers and patients. Second, to identify infectious disease infrastructure deficiencies in the COVID-19 pandemic. And third, to explain the risks of disability and death from not only acute COVID-19, but also the disabling effects of long COVID. Now, our partnering organizations with this event include the Massachusetts Nurses Association, the Kentucky Rural Health Association, Southern Kentucky AHEC, Massachusetts Association of Occupational Health Nurses, the Northeast Multi-State Division, and the Gardner Consulting Group. We had a fairly large conference planning committee from 3 different countries, Singapore, Peru, and the United States. And in the United States, we had representations from the states of Massachusetts, Vermont, Kentucky, Florida, Georgia, and South Carolina. To date, we've had over 250 registrations from a variety of different countries which span the globe from North America to the Far East. This graph shows the continuing education request of our attendees. 50% of the registrants requested nursing, 10.3%, physician category 1 AMA credits. The next highest was social work, and then a variety of other allied specialties. About a third of the registrants have requested no credits. The general public would be expected to fall into this group. Now, for questions to presenters, please place all questions in the chat. There is a Q&A area, but if you place everything in the chat, this will allow our speakers and moderators to just look at one screen instead of 2. We would also like to try to answer 1 or 2 questions with each presentation. We're going to reserve this time period till the end. Other questions are going to be answered after the conference in writing by the presenters and sent by emails to all the webinar participants. A few technical requests. 1, questions in chat. Try to keep your camera off to conserve bandwidth, keep your microphone off to prevent noise and feedback, and keep logged in between the morning and afternoon sessions so you reserve your space and make sure you're not knocked out of the webinar. And also, presentation start times are estimates. We've had to rearrange some of our speakers, and you will find an updated agenda at healthconference.org. In addition, you will find PDFs of the presentations that can be downloaded from healthconference.org. Now, continuing education is provided by two institutions. The first is Southern Kentucky AHEC. Southern Kentucky AHEC is providing continuing education for a variety of medical specialties and allied health specialties. Most specialties are offering 6 hours of continuing education. However, for nurses through the Kentucky Board of Nursing, 7.2 hours are offered. Radiology is offering, however, 5.5 hours. Physician credits are for Category 1 AMA. Now, you can only claim credit commensurate with the extent of your participation in the activity. You do not have to attend the entire activity. Post-conference, we will send an email which has links to allow you to complete the continuing education. You're going to have to complete a course evaluation and then get a continuing education certificate. Be sure to use the same email for your CE certificate that you used for your Zoom link registration. Now, continuing education is also being approved by the Northeast Multi-State Education Unit. They are an accredited approver for the ANCC nursing credits. 6 hours are being offered. Criteria for completion are that you have to attend the entire live activity. Partial credit is not offered. You also have to complete and submit a course evaluation form. Again, a link will be sent to you via email in order to do this, and this will be done after the conference. And you need to register for your CE certificate with the same email you used for your Zoom link registration. 2 presenters have declared conflicts of interest. One is Dr. Janet Haas. She is an active consultant for BD and in the past served on an expert panel for Midmark. And Dr. Nellie Brasselers. She's declared that she is a speaker for Ferring Pharmaceuticals. No other presenters or conference planners have declared a conflict of interest. Relevant financial relationships. This educational activity does not include any content that relates to the products and or services of an ineligible company with whom there is a financial relationship. Commercial support. There is no commercial support which has been received for this event. All information presented at this conference is the express opinion of the presenters, moderators, and or participants, and not necessarily that of HealthWatch USA or its partnering organizations. Nothing in the presentations should be construed as medical advice. One should always consult your healthcare provider before making treatment and healthcare decisions. Now, at this time, I would like to introduce our morning moderator, Dr. Matthias Maiwald. Dr. Maiwald is from Singapore. He is the Senior Consultant in Microbiology and the Head of Service at the KK Women's and Children's Hospital, and is an Adjunct Associate Professor at the Department of Microbiology and Senior Consultant in Microbiology, National University of Singapore, and at Duke University of Singapore Graduate Medical School. Dr. Maiwald, you have the floor. Thank you.